New research shows that thousands of American women have stocked up on abortion pills just in case. According to the study, a European health service received more than 48,000 requests from women in the U.S. who were not pregnant from September 2021 through April of 2023. The requests were for mifepristone and mifepristol, two drugs typically used for medicated abortions. So for more on this, we want to bring in Laura Lindberg. She's a professor at the Rutgers School of Public Health. This is really interesting. Thanks for joining us.
Thank you.
Who are these women that are stocking up on the abortion pills?
Well, so these are American women, and the data shows that the women who stocked up, that is, they ordered it in advance of being pregnant, were more likely to be white, were younger, and were for higher income communities than women who ordered these same pills when they were pregnant. So this is a much more advantaged group of people who are able to order it in advance prior to pregnancy. And I don't think we should be surprised by that, because the advanced provision pills cost $150, whereas if you are pregnant, this group is able to subsidize the cost and the price can come down. So it's much more expensive in advanced provision.
Right. So that's an excellent point, doctor, which is that it's people who can afford this medication who are able to preemptively get their hands on it. What about the women who face the greatest barriers to abortion, such as those living in states with strict abortion bans or who are with strict abortion bans, or who are not privileged enough to be able to get their hands or access to this medication?
Yeah, so I think we absolutely have to be concerned about people who can't access the care they need, whether that's by going to a provider in person or being able to order online. And that may be because of state laws and income or even information. It's not clear that everyone knows that advanced provision is even available or an option. But one of the things that this study found was that the people were more likely to be ordering the advanced provision pills in states where they were concerned that the state laws might change rapidly. So, for example, there was a peak in ordering following the Supreme Court's Dobbs decision leak. And those peaks were greater in states like Indiana or Ohio, where there was a risk that abortion would be banned.
So, I mean, are there any concerns from a medical sort of standpoint when it comes to women stocking up on these pills?
No, not at all. We have decades of evidence that this medication regime is safe, and people who are ordering it in advance still go through a health background check in order to get the pills, and there are a lot of resources available to them when the time comes that they want to use them.
So can you describe the ways that women can receive access to these medications? Is it just simply online? Is it by going to a doctor? Do they need a prescription? How does it work?
So there's different avenues to getting the same medication right now. So you can get this care through the existing healthcare system. So that can be going to a clinic in your community, and that is getting a prescription from a provider. You can also get exactly the same regime of medication through an online provider that requires a prescription. And then Aid Access, which is the group whose data this study is based off of, is based out of Europe and does not require American women to have a prescription in order to access the medication. And we generally refer to that as people who self-manage their abortion. That is, they're doing it without engagement with the formal healthcare system.
And so we know that the Supreme Court is expected to rule on limits on mifepristone, particularly whether or not, if you live in a state where there are abortion restrictions, can you still get it sort of mailed to you or delivered to you? What are the concerns if the Supreme Court determines that mifepristone cannot be mailed to someone who requests it?
I think we have a lot of concerns about that. We know that more than half of abortions in the U.S. right now are medication abortion, and that rate has been rising. So access to medication abortion has been an important tool to limit the negative effects of state abortion bans and barriers that have happened post-Dobbs. If the Supreme Court places new limits on mifepristone access, those limits are going to impact people regardless of what state they're in. It's going to supersede state laws around access. So it will have a very wide impact. It can have a very wide impact within the U.S.
All right, Dr. Laura Lindberg, thank you very much for joining us. We appreciate it.
Thank you.